welcome everyone. Thank you so much for joining us today for our Public Health Discovery Seminar Series. My name is Kayla Magruder, and I'm one of our lovely admissions counselors here at the Slade Scott Weatherhead School of Public Health and Tropical Medicine at Tulane University. I am joined with one of our lovely PhD students, Summyr Burton here, and she is going to talk to us today about her seminar, Stronger Systems, Smarter Responses, Translating Research to Readiness. Before I let Summyr take it away, I do just want to give a very few housekeeping notes. If you have any questions, please drop them in the Q&A throughout Summyr's presentation. We will have a brief Q&A session at the very end, so don't feel like you need to save your questions. Just drop them in that Q&A and we'll answer all questions at the very end, okay? Thank you all, and I will now hand it off to Summyr.
Thank you, Kayla. Yes, hello, everybody. My name is Summyr Burton. As Kayla said, I am a PhD student. I'm in my 5th year of the doctoral program in the Department of Environmental Health Sciences. I'm also the Senior Program Manager for the Region 6 Center for Health Security and Response Readiness, which I will be talking about today, kind of how we got started as a center and the things that we do and where we're at and where we plan to be over the coming year and hopefully years with continued funding. So today, what we're going to talk about is hopefully getting everybody on the same page with what public health emergency preparedness is, as well as getting to know a little bit about our region. We are currently in Region 6 as delineated by both the U.S. Department of Health and Human Services and FEMA. They both use the same kind of groupings around the country into 10 different regions. So we'll talk a little bit about what Region 6 looks like, a little bit about how we got started and funded as a network of regional centers, and then diving in a little bit about the initiatives that we're focused on. So we have 3 different initiatives that I'm excited to talk to you all about today. Starting off with what is public health emergency preparedness. So when we think about what this field looks like, it encompasses almost everything that we have when we think about disasters. It has the public health aspect, the healthcare aspect, and then the general public. Every individual that lives and breathes is also at risk of exposure to a disaster. So they're inherently involved in this process. And it's the ability for all of these systems and all of these individuals to come together in order to prevent, protect against, and respond to and recover from a health emergency. And a health emergency typically gets into kind of a disaster or a crisis mode when it overwhelms routine capabilities. So all of that has to do with, we need to be fully prepared, right? So it involves a really coordinated and really ongoing continuous process in order to advance our systems and our processes over time to overcome the next disaster. This is actually known and put into things like Healthy People 2030. So one of the goals of Healthy People 2030 is to improve emergency preparedness and response by building up that community resilience piece. Here are 4, I just listed 4 of their objectives, just so you can get kind of an idea of how I'll probably call it FEPR as we move forward, but public health, emergency preparedness, and response. This is how it actually works in the field that our center works through as well. So our objectives would be something like increasing proportion of adults who have an emergency plan for disasters. They know where their children are at any given time, and they have a plan for when their children are at home or when their children are at school, or what to do if you need to evacuate and you have 7 cats, a cow, and a chicken coop in the backyard. All of these types of situations need to be planned for in order to have a really good chance of overcoming the disaster that you're exposed to. Other objectives are things like increasing the number of individuals who are trained to prevent, detect, and respond to public health threats. These are your infectious disease specialists, your health department staff, your community health workers, any of these individuals that may be able to step in and provide that type of response when an actual emergency occurs. Increasing laboratory diagnostic testing capacity, surveillance, and reporting globally. These are all very, very complex and highly challenging aspects of response that we need to kind of really invest in on the forefront so that we can have a really solid response when a disaster starts. Think during the COVID pandemic, how quickly could we have stopped the outbreak if we had really rapid, quick lab testing on month one, right? Um, Other things are increasing the proportion of emergency messages in news stories that include steps for reducing personal health threats. There's an entire aspect of the field of public health emergency preparedness that focuses only on risk communication and how we can get high quality, correct, appropriate messages to the public in times of crisis. These are all kind of overarching aspects of what makes the FEPR field, one, so challenging, and two, so exciting to work in, because you can dive into all of these different aspects to improve the next disaster response. So with that in mind, let's look a little bit into what Region 6 looks like. So we have 38.4 million people in our 5 states, so New Mexico, Texas, Oklahoma, Arkansas, and Louisiana, as well as our 68 tribal and Pueblo nations. So 750,000 people are encompassed in those 68 tribal and Pueblo regions, which I believe is 25% of our nation's indigenous and tribal individuals. Really vast amounts of people. And when you kind of look at the different geographic profiles across Region 6, you can see the differences in threats, right? So Louisiana, especially down south and in New Orleans, where we're at, a lot of issues with flooding and severe weather and hurricanes. That's not exactly the threat that New Mexico is facing. New Mexico is more likely to face aspects of drought or wildfires, and everything kind of in between. We kind of run the gamut here, where we have an extensive amount of land on the border region, a lot of urban areas. We have 11 densely populated urban areas, 3 metropolitan statistical areas holding more than 2 million individuals, 8 cities with over 300,000 individuals living in them. So there's a lot of events happening, a lot of interesting dynamics occurring in all of these different areas. A third almost of our region is affected by a health professional shortage area, which means that there's truly not enough healthcare professionals to adequately address all of the needs of the individuals living in those areas. Our public health workforce is very, very young. So the governmental public sector workforce as a whole, 54% have only been in the field for less than 5 years. And 26% intend to leave or retire within the next year. So we can kind of start to see a little bit of how COVID and burnout and the mass attrition, they call it the Great Resignation. And this is a national level issue. In talking with all of the other 10 or 9 regional centers, they're having the exact same conversations that we're having about this. So that's not to say that this is something that is novel to our region, but it is something that's really, really important for us to understand as we're kind of navigating this space of improving practice, as we'll talk about a little bit later. And 20% of our public health workforce is having constant symptoms of burnout. I think about 10% are having any symptoms of burnout. So having a fifth of our workforce going through a really challenging time mentally and emotionally as they're navigating these really challenging disaster situations, it is really something that we need to be proactively attacking and trying to fix, especially as our hazards are increasing with global climate change year after year. We're having more frequent storms, more severe storms. So it's really something that we need to be focused on as we move forward. And in terms of disaster risk, as we talked about, all of the threats are kind of relevant to us in across our region. Not in every space will we have every hazard, but we do need to be aware as a regional center. If we were in New Orleans and only focused on hurricanes, we're leaving out a significant portion of our region. So making sure we're being aware of that. But either way, across our region in 2024, we had $45 billion severe weather and climate disasters. So these are things like flooding and drought and hurricanes and tornadoes. But that's not even taking into account the other disasters, the more man-made or technological disasters, the oil spills, the active shooters. There's all of these really complex and heavy crises that we need, but they don't exactly capture that in their statistical analyses. So that kind of data is a little bit harder to kind of get a hold of. But NOAA and the National Hurricane Center, they do a really good job of trying to encompass all of these more climatological disasters. So we do know that over $45 billion severe weather and climate disasters affected us. And that is really costly. And it really doesn't even get into all of the psychosocial impacts and the physical aspects of what a disaster can do to a community. We are the second highest release of toxics from over 3,200 TRI facilities. We have 157 Superfund sites. So there's a lot of environmental and human caused and all of these really heavy risks that we need to be able to understand as we go forward to see what our region really needs in terms of improving practice and improving our systems to combat these types of disasters. So now we can move on and give a little bit of a background to how we got to where we are as a regional center. This all started in 2020 with the National Academies NASM report. They did a deep dive into evidence-based practice in the space of public health emergency preparedness and response. And what they found was that there's really very, very little in terms of what health departments in particular can use to advance their practice. There were probably like, I think something like 9,000 different reports and gray literature that they went through. And out of all of that, they really didn't have many that they could go into the peer-reviewed literature and see that it was an effective, strong intervention to improve practice. So with that kind of more landmark report, there became an increasing amount of congressional advocacy to fund these regional centers. And in 2022, that funding was actually allocated as part of the Prevent Pandemics Act, included in the fiscal year 2023 Omnibus Appropriations Act. In the following year, the CDC funded an initial contract year, which I will kind of show you what we did in that initial contract year. But essentially, the goal for that was to bring a bunch of practitioners, multidisciplinary, cross-sectoral public health emergency practitioners together and essentially conduct a needs assessment, figure out what the needs were for the region and how we could leverage and guide our center to engage in the work that actually meets the needs of our region. And after that, our regional centers were fully funded in 2024. We just started our second year in 2025 to 2026, which we're really excited about having funding for. And with that in mind, let's go into what our center is. So our center is directed by Stephen Murphy, who is the director for the disaster management and health security program under the Department of Environmental Health Sciences here at Tulane. I am the senior program manager. I kind of facilitate all of the comings and goings for the regional center as a whole. One aspect that we really like to champion is our steering committee. So our steering committee, this is slightly outdated. We now have all 5 state health department FEP leads as part of our steering committee. So we really have our hands in all of the states, really maintaining a pulse on what the actual needs are. We have local health department participation, and then we also have a lot of tribal participation. So our main goal here is to maintain that kind of ability to go to the actual practitioners and understand what the needs are as we move forward across the board. A lot of other regions do the same thing. They will focus and prioritize or reprioritize as needed. I know after our initial contract year, we all had, well, 7 of the 10 centers all had fully realized work plans, and then Hurricane Helene came in, and the destruction that occurred in North Carolina and Tennessee necessitated one of the regions to completely kind of scrap their initial plans and reroute their work in order to help out with the current needs that were going on related to that kind of hurricane response and recovery effort. Out of our Tulane team, Dr. Leah Saltzman is one of our co-investigators. She is actually at the School of Social Work. And then Dr. Jeffrey Elder, he is I believe he's now the Chief Medical Officer for LCMC Health. So he was also the medical director for New Orleans EMS. So he has kind of that more strong pulse in the healthcare and EMS side of things, which really helps give us a really well-balanced idea of what's going on. There's also myself, who's a PhD student, Suraj Kanan, who's also another incoming PhD student. And then we really enjoy having a lot of students and research students and graduate research students come in. We've had a few MD and PhD students come in and do some fun, exciting projects with us on some of the initiatives I'll talk about later. But it's really a good chance for all of our students to really come in and engage in the work, engage with real world practitioners, and kind of get our hands dirty into the real disaster sector that we are in. We have 2 sub-awardees, one with Texas A&M, and that out of Texas A&M, it's the USA Center for Rural Public Health Preparedness, and then out of the University of Oklahoma, their Center for Public Health Practice. They're wonderful teams. We work with very, very diligently to make sure that we're all creating really high quality products. And then the mission of our center is really to strengthen not just the operational response side of things, but also the crisis leadership aspect of things. And we'll talk a little bit more about this when we kind of do a little backtrack and run through what we uncovered in that initial project year. But we really found it to be of great importance to not only make sure that we're focused on the policies and procedures that we lean on during response, but also to the people themselves, and making sure that they feel confident and capable of doing that response. So we want to focus on both of those things. And to do that, we're focused on leveraging the evidence base. As that National Academies report showed, there's a lacking of that evidence base. So we're trying to go into the literature, see what is out there, and then work with our real world practitioners and make sure that whatever product, whatever resource we're developing is both practice-based and evidence-based. And that's kind of a core tenet of our work. And we also really strive to be a force multiplier across Region 6. So to be a force multiplier, it's almost like being there when there's not many other people there. So for example, during the Super Bowl that was held in New Orleans last year, we worked with the Louisiana Department of Health to serve as kind of surge support for a potential need to kind of disseminate prophylaxis. They're called points of distribution. And if anything were to happen, think the COVID pandemic. When we rolled out the mass vaccination clinics across the city, that would be something like a point of distribution. So if something were to happen, we were there and ready to kind of step in and help the Louisiana Department of Health, providing people, staff, resources, expertise to mount a response in case anything were to happen. So stepping in where there's a need, and quite frankly, every health department across the nation has that need. They always need more help. They always need more volunteers. So as an aside, if you're ever interested in New Orleans, if you're based in New Orleans, looking into things like NOLA Ready or the Medical Reserve Corps, great volunteer opportunities. I can absolutely speak more to that. I've served on both throughout my time in New Orleans, and they were great experiences as a student and as a where I'm at now. It served as a really solid guiding experience for me. But all of that to say, our vision is really to enhance public health emergency preparedness and response infrastructure and systems in order to address our 21st century health security threats. And that's both within Region 6 and beyond. Getting a little bit into the actual project year that we worked in. So as I said, our focus was really on convening a group of practitioners, and that wound up looking like each of the state PhEP leads, the public health emergency preparedness and response leads, the tribal health departments or governments, local health department practitioners, but particularly those that work with different population types. So those that worked in really urban environments, those that worked in really rural or frontier environments, those that worked with individuals with limited English proficiency, and then also bringing in people, cross-sectoral, multidisciplinary people from the healthcare facilities or healthcare coalitions. Again, both those serving urban and non-urban jurisdictions, as well as the K through 12 public school systems. And I think this was a shock to many people, wondering what they have to do with disasters or public health emergencies. And the answer is kind of a lot, right? If we really start to think about it, COVID and schools was a hot topic for a very long time. The school system has a lot to do with emergency preparedness, and it's always important to kind of bring everybody on board that does play a role in that space, so we can actually hear them and hear the diverse perspectives across all of these jurisdictions and all of these sectors and disciplines to make sure that we're not leaving anybody out. And then the last group being the institutions of higher ed. So Tulane and then Texas A&M were really big players as part of our coordinating body. But there's tons of different academic institutions that are really heavily in this space. So what we did during this project year was we really focused on allowing their voices to come through. We had a structure to prioritize these focus areas. We gave them 10 focus areas, and through a modified Delphi process, we kind of asked them to rank these focus areas over time. What are the biggest focus areas for your job, your role, your area of expertise, the people that you serve? Tell us what the needs are. And from that, we were able to identify three top priority focal areas, one being workforce development. That was by and large the first and primary need. We'll talk about that more in the next slide. The second was multi-sector partnerships, and how do we have all of these different sectors coming together, all of these different disciplines coming together and working together in a disaster scenario, which is far more challenging than I can ever really articulate. But I'll try to in the next slide as well. And then the third one being data and information governance. So what data is collected, how it's collected, where it's managed, where it's stored, how long it's stored, all of those different evolving aspects. So what these focus areas truly looked like. So workforce development, the first one was above and beyond mass attrition. Our great resignation has impacted Region 6 FEPR staff in a way that few other disasters have. They were working for a very, very long time, very long hours for an extended periods of time. So we have kind of those people leaving from burnout and just stress, moving into other positions, academia or private practice. And there was also at the same time a lot of retirement happening, which is expected. But what was missing there was the lack of succession planning. So how does the senior level executive pass down all of the knowledge that they've accumulated over the past 20 or 30 years and into the new staff? And there is very poor succession planning through no fault of their own, but it's just not something that has ever been thought of. And now it's beginning to be a really big problem. And their current professional development practices, they're developed or disseminated haphazardly. They're not really high quality. They're not exactly developed by individuals with expertise in adult learning principles, or they just don't really fully translate to the Region 6 perspective or to the public health emergency preparedness and response sector. The multi-sector partnerships and training, most of that was due to just poor information exchange. So a lack of plans or protocols or procedures that are bringing these different sectors together in a formalized way. So what typically occurs is as soon as a disaster occurs, they're now understanding that they need to be connected to that sector or this sector, and they don't know anybody that's there. They don't have their phone numbers. They got to go figure out how to develop a relationship with them in the moment. And because of that, there's a really poor amount of coordination between partners and sectors and a lot of information silos, which bleeds into the third focus area of data and information collection, management, and training. So information silos really happen in this space when all of these different sectors have their own software systems, their own way of collecting the data, so different codes and ways of inputting the data that don't exactly translate across sectors. So There's that issue creating information silos. So you're not really getting that exchange of information. The technology is all different. So there's all of these issues with sharing information during a disaster. There's also in our field a really difficult time with using innovative technologies, whether or not we don't know what is the best technology that we can use. How do we use AI in this space? All of these different questions were arising from our group. And then a poor understanding and utilization of all available data and experts. So one example being, we have this wastewater surveillance technology, and that is spreading in more and more parts of our country. But our coordinating body members were saying they don't really understand how to leverage that data. What does that even really mean to have a positive sample come out of wastewater surveillance tech? What does it mean when there is a positive virus detected in my area? Does that mean that I shut the whole city down, or does that mean that I just kind of ramp up case investigation? So there were all of these kind of conversations happening, and what we came up with as part of our regional work plan for the workforce development piece, what we wound up doing, and it's currently undergoing pilot testing. So again, happy to answer any questions related to this one in particular, but any of them, honestly. But we created a training program focused on crisis decision making. And this was a really solid way for us. I'll actually just go to the next slide so we can see it all together. It was a really solid tool for us because the one that we identified focuses not just on traditional kind of deliberative processes that don't exactly go into the bread and butter of how you actually make a decision. It's just kind of a checklist, or here you do this and then this and then this. The framework that we decided to leverage goes in depth into all of these different ways. If you have time to deliberate versus if you don't have time to deliberate, what happens when your entire team is incredibly stressed out and burnt out from the last disaster. All of these different, really fragile, more nuanced, and really complicated ways of viewing decision making in a time of crisis. So we were really excited about using that simply because it translates far past just the individual level. So it's based on what we call the OODA loop, which is an old, long-standing militaristic style of decision making. It's called observe, orient, decide, and act. And you can see kind of the framework right there. And what it does is it goes in depth into, okay, so you have a decision that you need to make. And if you have no time to deliberate during this crisis, how are we going to navigate that space? How are we still going to get multi-sector input on all of these diverging goals and objectives and response operational aspects? And it goes into not just the deliberative aspect of it, but it zooms out to help you understand the emotional aspects, the cognitive biases that we all inherently have. And then critical to this framework is also the different public health considerations that need to be taken into account to inform your decisions. So it goes into the ethical, the logistical, and the political aspects of a public health crisis. So is what you're doing legal? Is what you're doing for the greatest good, for the greatest number? Is it ethical that you're planning to do things this way? So it gives a really solid structural framework. And what the training program is, in and of itself, is we are focused on having that training program component, but with this group of health department practitioners, they already have a pretty strong understanding of a lot of what it takes to make a decision during a crisis. So we're giving them this new framework and having a lot of active learning participation. So a lot of interactive case studies, a lot of think, pair, shares, a lot of just facilitated discussions, and we'll have a culminating kind of large, not large scale, but it's a full tabletop exercise. For those of you that aren't exactly familiar with those, a tabletop exercise is where you kind of sit down and you run through a full disaster scenario, and have a facilitated discussion amongst the team. And typically it is to identify the different ways that our policies, our plans, our procedures need to be kind of changed. And it's a good way to test our plans and our policies and procedures. In this sense, we're asking them to kind of come together and work together to apply this framework and apply the process of the framework in a real-time space. Going back to the other activities, so we have quite a few. I'll dive into one of each of the other focus areas just for time. But our multi-sector partnerships, our core activity there is going to be something called the Facilitating Unified Sector Engagement, or the FUSE project. And what the FUSE project is we're creating a way to not only build relationships in the front end, but also teaching health departments how to build their own relationships sustainably over time, depending on the sector that they're aiming to build that relationship with. So we're going to be working directly with health departments to conduct a full network mapping analysis. So we're going to be working with them to identify where the relationships are, formal or informal relationships, analyzing those for quality, and trying to see where their strengths and weaknesses lie in terms of their networks. And the goal with that is to be able to identify a sector or an individual group that they would really like to have a stronger relationship with, and providing with them with the tools necessary for building that relationship. So providing the technical assistance, whether that be trainings or joint exercises, or just bringing them together to sign a formal document saying that we are partnerships and I will do this in a disaster scenario and you will do this in a disaster scenario. That is a project that we're really excited to be working on. We're currently pilot testing different network mapping analysis tools to figure out what works best for our health department practitioners across the region. The last project that we're really diving deep into is focused on mass gathering emergencies. And I don't exactly have to give you the full definition of what a mass gathering emergency is, but you can kind of understand that it's a lot of people and a lot of different agencies and organizations and jurisdictions coming to assist with that response. There's a lot going on in these types of emergencies. And what we found was there's not a strong number of tools to have a shared understanding of what data needs to be collected and what data needs to be shared and how to share that data during this type of event. So we're really excited to be hopefully developing that tool for our health departments to be able to have and to share with their cross-sectoral partners, and with a goal of getting everybody on the same page so that there's faster information exchange, there's faster data sharing during these really critical events. I will stop there just for time. Happy to answer any other questions that we have. Kayla, I don't know if there's any questions that have popped up.
Thank you so much, Summer. That was amazing. We don't have any questions dropped in the Q&A just yet, so I will now open the floor for any questions that you may have for Summer. Please drop them in the Q&A and we will go in order.
I'll also just pop this up just in case, but you can always email us at our r6healthsecurity@tulane.edu email. That is directly sent to me, so I will be able to answer any of your questions there as well.
So I see your question you just dropped into the chat, Prosper. Please feel free to connect with me about that, and we can chat a little bit more one-on-one. I will drop my email in the chat for you. I just dropped my email in the chat. Feel free to shoot that over to me. Yes, absolutely. Do we have any other questions? All right, well, if we don't have any additional questions, I will let you have. Oh, yes, we got some thank yous in the chat. Thank you so much, Summer. As I stated a little bit earlier, this was great. And oh, okay, Prosper, we'll connect one-on-one. I see your additional question. Just for time's sake, we can connect with that when you email me one-on-one. We do have a question in the Q&A. Um, do you feel individuals in the community are open to the services you provide?
So our focus has been mostly on working directly with the health departments themselves. So we haven't exactly been working one-on-one with the community members. But I will say we've had a lot of interest on particularly the crisis decision-making project that we've been working on. A lot of, not even just health departments, we've been also speaking to emergency management agencies as well. And a lot of them are really excited about this opportunity. The majority of training programs and trainings that are available are very dry, and they lack a lot of the nuance that is so common in public health emergencies. So they're saying they're really excited about that piece, and just kind of having access to a a center that is dedicated to advancing their practice and truly listening to their needs. But in terms of the community themselves, I really can't speak to that just because we haven't really worked with them one-on-one yet.
Thank you. We do have another question. What led to using the OODA model?
So the OODA loop was it really was used by the framework that we have decided to use. And I might take a second so I can pop up that article in the chat. But the framework that we were using, they leveraged the OODA loop just because it was so well known and a very easy model to understand. I mean, when we're saying observe, orient, decide, and act, that already makes sense to the vast majority of us. So there's very little excess stuff that needs to be taught there. But they leverage that in by that for that reason. And I'll pop it up just so that you can. I apologize, that's not the DOI, that's the full URL, but it should work for everybody. Yes, it is replicable. And what we are trying to do is we're trying to expand now. We're talking to several other regions on how we can kind of collaborate and continue to grow this out. But yeah, the intent is for it to be almost asynchronous in a year or two. For ongoing learning that is not exactly in the health department space, one-on-one with the teams themselves. So hopefully you all can take it at some point.
Thank you so much, Summer. We also have some thank yous in the chat. We do have another question.
Okay.
I like the model of this research. I work in a similar project and I find coming together to pull a term of reference outlining responsibility of each partner is very critical. How did you bring all these together for workforce development?
Coming together. So we're we're focused on doing that for some of the other activities. For this one specifically, we're trying to leverage the incident command system and the existing plans that they have that would have something like an organizational chart with some semblance of roles and responsibilities. But we are leaving that one up to them for the crisis decision making training itself. We for most of what we do, we're kind of deferring to the health departments in those aspects, just because they kind of know their jurisdiction and know what their roles and responsibilities are. So it's really for us, it's been just a question of, okay, who is responsible for this and who should be at the table for this, rather than us kind of creating those roles and then telling them what they should be. That's been our approach. I don't think that answered your question. I apologize, but that's kind of how it goes.
Thank you, Summer. We have another question. How do universities collaborate in emergency settings?
It depends on many jurisdictions. So there's been a lot of literature calling for more integration of these academic institutions into the response. And during the COVID pandemic, there were many different colleges that stepped up, whether it be by kind of educating and getting their nursing students or their pharmacy students trained in real time in order to help out with the response. A lot of public health schools stepped in to help with contact tracing and case investigation. Um, there there are a lot of really solid frameworks, but there's so much more to be done. One of the initiatives that we're interested in doing is creating a cohort of students that is capable of helping with data collection during a disaster situation. It's very easy to say that they should be collecting all of this information during something like a mass gathering emergency, but whether or not they have the actual capacity and the staffing to collect that data is a whole other beast, right? So what we are hoping to do is create that cohort that we can leverage in those times of crisis to help with something like data collection or case investigation or any of the other operational response activities that need to occur during these times.
Thank you so much for that, Summer.
Yeah.
We have just a comment in the chat. It's great real world experience for all disciplines, masters or DRPH, working in the local state health department.
Crucial. I'm learning more and more every day just how crucial that really is. And I will say we've had probably 5 students, myself included, come through this center and do some of that work. And being able to actually work one-on-one with practitioners, I think has been a really vital learning experience for all of us involved. You just don't know until you know, right?
Absolutely. Absolutely. Well, I want to thank you so much, Summer, for providing us with this lovely seminar today. And I want to thank all of you who have joined us for today's seminar. As Summer put up her contact information, feel free to contact her if you want to discuss any of her seminar one-on-one. You can also feel free to contact me for any one-on-one questions. I did put my email in the chat as well. I want to thank you all again for joining today. Summer just put that email back in the chat if you would like to contact her. And I will let you all have the remainder of this hour. Thanks so much for joining us. Have a great day.